Hello, everyone, and welcome to another episode of T-Chat. I am Quinn Bennett. I am an outreach specialist with Mozaic. I use he, him pronouns. Today, we are here with Sara and Teagan. Sara, tell us a bit about yourself. When did you start providing medical care, and what kind of background do you have?
Thank you. My name's Sara. I use they, them pronouns. I'm a nurse practitioner, and I've been in primary care for probably 2.5 years now. I've been a nurse for over 20 years, but I really love being a primary care provider. I went back to school so that I could specifically become a primary care provider, and really excited that my line of work has led me to Equitas. I think I'm in the right place.
Awesome. That's a lot of experience. That's pretty cool.
Yeah.
You have any fun facts that you want to share about yourself?
Yeah, so I, in my free time, like taking my dogs for walks, going on hikes, and I play roller derby, which I feel like is always a really fun fact for people to learn.
Nice.
My name's Teagan. I use she, her pronouns. I don't know, a super fun fact. I love spending time with my wife, my friends. I'm a huge board game person. Right now I'm all about that train game Ticket to Ride as my main board game choice. But I'm much less exciting. No roller derby for me.
Plug for Mosaic's monthly game night. We'll have to play Ticket to Ride one of these days.
Come on in.
Very cool.
So obviously today we're talking a bit about gender-affirming care and some different things that folks can expect, especially during that first visit. But just thinking about in general their care and what that may look like from your lens, Sara. Before we get too far, though, could you tell us a little about what gender-affirming care means to you?
I just really have a strong belief that gender-affirming care is caring for the whole person, and it's an integral part to primary care in general. So I think it was like the perfect match for me, wanting to do primary care and knowing that there's a need for folks who will and can provide gender-affirming care effectively. So that's why it's so special to me, I think.
Amazing. Yeah, that's really great. When you think about like gender-affirming care, is that like hormones or surgeries, or like what does that look like for you?
Yeah, that's a really great additional question. I think there's so many things that can be considered gender-affirming care. Just walking into an environment where you feel respected as a whole person and your gender identity is part of your healthcare is the starting point. But then absolutely, there's hormones, there's surgeries, there's different types of therapies like voice therapy. There are athletic trainers who can help you feel more affirmed in your gender. Like there are so many different resources for gender affirming care, I feel like.
Amazing. Yeah. Lots of different options on the table.
For sure.
Once again, going to that whole, the whole human, like there's multiple areas that can affirm your gender. So what does that like first visit look like?
Oh, the first visit, I feel like just anecdotally what I've seen is folks are very nervous when they come in for their first visit. But that's part of why I'm here today. I would just really like to kind of calm those nerves a little bit. The first time in any doctor's office for someone who identifies as queer, LGBTQ+, in any way can be a little nerve-wracking. But when you walk into the office, you're going to check in with folks who are going to be respectful and kind of ask you your name, your pronouns, and your identifying information. Once we get you checked in, we take you back and we start the process of kind of going through a checklist of things that we need to make sure that you're healthy and physically ready for gender-affirming care. You'll meet my nurse first, usually. My nurse or my MA will work with you to get the basics of your history, and then you'll get to meet me or one of my colleagues if you're seeing another one of our providers. And we start the process of kind of verifying your medical history, but also talking a little bit about your gender history and just kind of what your goals are. I really feel like that first appointment, folks are really nervous to come in, what to expect. I kind of feel like it should be more of like this conversation that we're having right now, like person to person, kind of getting to know one another and really focusing on like what this patient's goals are, what they want out of gender affirming care. Yeah.
I imagine a lot of that I would say I know also from personal experience, a lot of that nervousness is because it's like mysterious of what that first visit looks like.
Yeah.
Once again, while we're doing this podcast to like help people know what to expect, so it's not so shrouded in mystery.
Right. Yeah. I think if you've ever been to any doctor's office, I do think that the initial steps of checking in for an appointment for gender affirming care probably are going to look pretty similar. Your basic health insurance information or demographics, and collecting all that out front, then getting your vital signs, and then you get into the fun part, I would say, of talking a little bit more about questions you might have about gender affirming hormones or surgeries or legal name changes, things like that, that this person has probably been waiting a really long time to talk to somebody about. Yeah.
What are some of those questions that people may ask you, like in the first visit?
So I think a lot of the questions that I get in that first visit are, A, what does my access to gender affirming care look like? What can I get? B, I think if they are interested in hormone therapy, will hormones do for me what I really want in order to be affirmed in my gender? What kind of effects can I expect? How long is it going to take? How much is this going to cost? How often do I have to come into the office? So I think I try to spend a lot of that first visit kind of setting expectations for what this process is going to look like. And I do, it's probably a tired term, but I do like to kind of use the idea of a second puberty as like a thing to kind of give yourself a pace or like a sense of how fast things are going to move. It takes time so that people aren't leaving the office with like unrealistic expectations on what gender affirming care can do for them.
Yeah. That's so important. Do you have any other like kind of high level goals, for that first visit? You mentioned kind of answering questions and setting expectations. Yeah.
I think that some of the really important goals that I like to get through in that first visit are doing some risk versus benefit discussion. If someone comes to me and they're really specifically wanting to get on hormones, I acknowledge that it's probably not something that they thought of yesterday. Most of the folks that I see have done a lot of research on their own, but they might have more questions about like the technical risks and benefits of what hormones can do in their body, side effects that they might have, things that they may need to expect as far as further down the line for health screenings, because some of those things might shift if they stay on hormones for a long period of time. So I do like to really be thorough with my history, not to get data that is unnecessary, but really just to focus on, hey, are you at a higher risk for certain things with regard to using hormone therapy? So the risk versus benefits discussion, I think, is like a really important goal for me. And then also to get a sense of what a patient might be comfortable with or what might benefit them most with the type of hormone therapy that they pursue, because there's different routes that you can take your hormones, and some folks struggle with remembering to take a pill every day, so shots or patches might be better for them. So I do really try to get through some of that in the initial visit too. And then another big goal that sometimes people don't think about is that baseline health assessment before starting on hormones. So it is important to have some baseline data on labs and things like that before we get started on hormones, because there can be some changes to those labs over time, depending on what kind of therapy you're on. So I do always like to at least try to get through that as an initial step in our first visit too.
Yeah. It seems like you're really caring about your patients and ensuring that you're not just kind of throwing hormones at them, but their other health needs are also assessed.
Yeah, I do think it's a very thoughtful process that each of us providers go through with each of our patients. We really are, it may seem kind of overwhelming to answer all these questions in this new visit, this first visit, but it is like trying to personalize this therapy to the person. I'm gathering a lot of data about your health history, your family's health history, potential future risks that you might encounter if starting on hormone therapy. And then also I'm gathering a lot of data on what your preferences are for, planning for families in the future, or a desire to not have a family in the future. Like there's a lot of really important data that comes out of these questions. it can feel very overwhelming for a person to have to answer all of those. I do always let a person know, like, if there's ever something that you're not comfortable talking about, you have the right to absolutely say, hey, this is not an area I can really discuss right now. And we can come back to that later if we need to. But always about making the person comfortable, but also trying to like get as much information that I can that'll help me make the right decision for a patient with gender affirming care.
It's nice knowing the why behind like why those questions are asked.
Yeah.
Because I know like you said, a lot of people might get overwhelmed with that, but like knowing like, oh, this is to help like chart your journey, your gender journey, as it were.
Yeah.
Speaking of gender journeys, you did mention getting like a gender history of the patient. What does that look like? Like, what are you looking for people to answer when you do ask about their gender history?
Yeah. So it's a sensitive subject, right? Because folks that are coming to see me for gender affirming care may be out to some folks, but not out to everyone. So for me, I think a lot of what I'm asking in those questions is trying to get a feel for where they are in that process. When they started thinking about gender affirming care versus when they maybe started to socially transition, coming out to folks, and how that process was. It is important for me to know if a patient, for example, has some trauma through that process of coming out, or certain medical exams that could potentially be traumatic for a patient. Also, it's also some questions about, I think I mentioned earlier, like family planning. It gets to know the patient a little bit more about what their sexual health needs may be, both before starting hormones and after starting hormones, and gives me a little bit more of an idea of other services other than just gender affirming hormones that they might require in the future. So surgery is definitely being probably the most talked about one, but I mentioned vocal therapy, laser hair removal. Like, there's a lot of other referrals that we can start to consider and talk about. And that gender history kind of helps me get an idea of what things might line up or match up with their goals. Yeah.
And I know too, like we say gender affirming care, and it sounds like you're really like affirming people too. And like, I think about folks who come in for their first visit, kind of ready to kind of advocate for themselves and ready to like explain, this is how I know I'm this gender and everything. You know, do you ask like, well, how do you know you're really this gender? Is that like a conversation you have to go through?
Yeah. So, I mean, it's really not, it's not about me second guessing you in any way. I think I mentioned earlier, most of the people that come into me have done their research and they've been thinking about this for a long time. So not at all to second guess like your identity is your identity. But it really gives me a little bit more information to include in notes for the future. For example, if someone does want to go for gender affirming surgery in the future, something that's really going to help them to feel more like themselves, having some of those details to support, like, this is something that's going to greatly improve this person's quality of life, because XYZ is the journey that they've been on, really does, it just kind of helps me nail down, this is something that you've been going through for years, or months, or however long into the journey you've been. But it's not something that is trivial. It's something that's very important. So I think getting some of those answers, if you feel comfortable sharing them with me, can really help support that, like in future healthcare decisions.
Yeah, that's always relieving, I think, for people to hear. You know, even when I reflect on myself as a trans person, when I first entered care, I thought, okay, I'm going to have to, shoot my shot, and I'm going to have to convince this person, and like really, here's like my 5 different arguments and everything. And in reality, it seems like it's much the opposite of like kind of accepting that they are who they tell you they are. Yeah,
definitely. I think nobody knows my patient as well as they know them. So I really am just trying to get their perspective on their identity and kind of the journey they've been through to get to where they are today, and where they would like their journey to ultimately end up. And how fast we get there is up to them. So I think all of this information gathering just helps me get an idea of how we get to where they want to go. Yeah.
Yeah, and then also you mentioned like having that documentation, because even though you are an affirming person and believe, what they're telling you, that data is needed for insurance companies and everything
Yeah.
else. So
we still live in the healthcare system that we live in, and there is a need for some documentation and evidence of conditions that require gender affirming care. So really, it's part of the process. It is for some people a little bit more painful to get through that part than others, but it is always coming from like a place of respect as far as me as a provider. Yeah.
I know one other thing that kind of comes along with that gender history territory is a lot of folks like feel worried that they may come in and may not be trans enough for hormones or may not be non-binary enough for care. If you could like speak to that a little bit, or like, or is there any like narratives that you're anticipating people to tell you they knew that they were trans from 3 months old?
Yeah. I think another really important part, in addition to the disclaimer that if there's information you're not comfortable sharing, you don't have to, there's also no right answer. All of these questions can be very personalized. So, non-binary folks, gender fluid folks, folks who may have a gender identity but a gender presentation that is a little off from that gender identity's quote-unquote expectations in society. I try to be respectful of all of those things, but I definitely have encountered folks who are nervous when they come into that first appointment, that they won't say the right things and they then won't get to access the care that they need. I do try to say like, hey, there's no right answer. Share what you feel comfortable with and be as honest as you can, because this is really just me getting to know you more than you meeting a qualifier to get gender affirming care.
I love that.
Yeah.
I once had a physician critique me because I wasn't carrying a purse with me. And I was like, okay, are you still going to write my script? Or what are we doing here?
So frustrating, yeah. And I think as we get into gender affirming care further, as a profession, I think we're starting to realize like there really does not need to be a strictly binary presentation for trans folks. There is a whole varying degree of transness, and that's perfectly okay. Your gender expression does not determine how you access care, for sure.
Totally. Absolutely. So we talk all the time in healthcare a little bit about like patient-centered or like kind of person-centered care. And I think you've kind of hinted around this so far in our conversation, but could you tell us a little bit about these terms and kind of what they mean to you?
Yeah. So patient-centered care is coming from a place of, understanding that in order for that person to get in front of you for this appointment today, they have a myriad of different barriers that they have to get over. So they may have had to take the bus versus trying to find parking 5 blocks away and then get into the office to see you. So really focusing on what that person's needs are outside of that medical appointment is important. Their social determinants of health, if you will. The things that make them a person in their community are just as important as what makes them a patient in your office. So I do try to respect that person for where they're coming from. Some of my questions in my gender history actually do go into like, what is your background with school? What are some of the hobbies that you like? What do you do for work? Do you work? These are all questions that can help me kind of get a better understanding of where this person's coming from. Also, we aren't just seeing you for your hormone therapy. I provide primary care, as do a lot of my colleagues. And you're not just a person that's taking tea. You are also a person who is dealing with diabetes or has high blood pressure or has mental health conditions, as so many of us do. And so I think it's really important to see that person for all of those factors that are contributing to who they are.
Yeah, absolutely. You think about like all of that, kind of seeing people for who they are, and kind of advocating around that too. What do you see like the role of the healthcare provider in kind of furthering that provider-patient relationship, collaboration, while also working through that lens?
Yeah. I would love to see a healthcare world in the future where we are, all of us as professionals, able to see the person for who they are, respect them for who they are, and treat them for who they are. truly doing no harm and helping the patient with whatever kind of help they need. I think that's why I love doing gender affirming care so much, is because you get so much of that benefit out of seeing a person get the care that they need, that they were really worried they would not have access to. So I think as a profession, I'd love to see more primary care providers being comfortable with caring for patients who are on hormones and becoming familiar with their unique needs and being respectful of a person's gender and sexual identities as a part of their whole healthcare needs. Like, those are important things that need addressed for them to be healthy and happy.
Love that. Yeah. It's very like treating folks for who they are, but then also helping their gender goals too. Like, I think with gender goals that, there's not necessarily like a number that we're, giving them. Like, it's not an A1C or a blood pressure, as those gender goals can often be a little nebulous at times.
Right.
I think getting to know that human being and who they are really furthers some of that dialogue as well. Absolutely.
I think it helps foster like a more personal relationship between the provider and the patient, for sure, because you really are trying to become more in touch with how they feel about the changes in their health overall over time. It's pretty neat.
Yeah. It's really unique too. I can't think of a lot of other areas.
Right. Yeah, we don't ask people often how they feel about their A1C or their blood pressure reading.
Probably should.
Yeah, we probably should.
The healthcare landscape.
Yeah. I think we focus more on numbers with other forms of care, but we're not really judging by metrics, and definitely not judging by your presentation when you come in to see me, whether you're feminine enough or non-binary enough or masculine enough.
What would you tell somebody how to prepare for their first visit?
I do find it is very helpful when you do some introspection, when you kind of think about what are my goals with gender identity, gender presentation, things that make me feel more comfortable, things that make me feel uncomfortable. Really having kind of a good grasp of those basic concepts are very helpful when you come in for your visit. If you have access to your prior medical records, that can be helpful too. With the electronic records as they've developed, it is easier to get access to the things that we need with your permission. But some people come into me straight from a pediatrician that doesn't use Epic. And so maybe having access to some of those things can be helpful. But really, there's very little that you have to bring with you. Just kind of your ideas of what you want for gender affirming care. If you have questions about the fine details of that, that's completely fine. I am full of resources. Our organization is full of resources. I would direct folks to maybe review the Gender Affirming Care Guidebook. It's available on our website, I know, and it is super helpful. It can go over all kinds of things that you and I will talk about in our first visit, including the different methods of hormone therapy, support groups, resources in the community. There's so much information. And I think that is really where I get a lot of questions, is about, how do I give myself my hormones? What timeline am I going to expect to see hair growing on my mustache, or different changes in hormone levels and how we do labs? There's a lot of information in that guidebook about those things. So I think that could be helpful before coming to your first visit.
Yeah, it's a very detailed guide. Like you said, you can find it on the Equitas Health website, or if you ever stop in Mozaic as well, we do have that access to that. I like the introspective of what makes you feel more comfortable and what doesn't make you feel more comfortable.
Yeah.
I feel like a lot of times people get stuck in either one or the other, but knowing both of those is more helpful in figuring out what you want on your gender journey.
Yeah. I love the fact that I get to ask questions about what causes you dysphoria and what causes you gender euphoria. That's really a really great shift of not just focusing on the negatives. And and it kind of can give people some hope of like expressing what they would like to see more of. So,
yeah, that's so important too. Is the presence of that positive, or like finding that positive.
Yeah.
I love that. I think too, to kind of summarize, it's sounding like less like have the full checklist of everything, but more like a general sense.
Yeah, I think you don't have to have a specific checklist met when you come in to see us for the first time. Really, if you feel ready to come in and get gender affirming care, just do it. I think the biggest thing is like knowing what you want out of it, and being able to express kind of things that you feel comfortable with and less comfortable with. Yeah.
Are there any, like, I know you said earlier there are no wrong answers, but I know oftentimes folks may have a difficulty expressing, like, oh, hey, this body part that I don't really talk about with a lot of people, or, maybe gives me some feelings of unease. Do you have any, like, words of wisdom for folks who may struggle a little bit about, like, expressing a desire for more or less of some of those things?
Yeah. So I really sometimes take for granted that I work in an environment that is so, I guess, sex positive. And I am totally comfortable talking about body parts if the patient's comfortable talking about those body parts. I do sometimes try to ask about language that the patient might be comfortable using when talking about different body parts. I do think it's an important part of the conversation that, parts of your body will change with hormone therapy for sure, and definitely with surgical intervention for gender affirming care. So it's part of the conversation, definitely. It's almost always part of my risks versus benefits conversation, because the thing that I would hate is for a patient to not really have the full expectation of what will happen, not just in the first month or 3 months of being on hormones, but after the, 2, 3, 5 years of being on hormones, your body really can shift a bit. So having that heads up is important for that first visit conversation, I think, too.
I love that. And obviously, like, some of these things can change too, right?
Yeah.
Maybe from the first visit to second visit.
Yeah. I think that definitely some people get more comfortable in the second visit talking to me about subjects that might relate to parts of their body that they were not comfortable bringing up in the first visit. I do try to keep that door open as a conversation throughout our follow-ups. I do generally ask about like sexual health in some manner. And so if that's something that changes over time with hormone therapy or other gender affirming care therapies, we can absolutely have that conversation and say, hey, this is changing and I'm a little less comfortable about it now. What can we do at this point? Or what do we do from here, essentially? That's always like an evolving conversation that I have in my follow-ups. Yeah.
I love that. Open door policy.
Yeah, for sure. Yeah.
So there's, obviously a lot out there about hormone therapy and sort of like getting on estrogen, getting on testosterone. What does starting these things, starting like testosterone-based hormone therapy or estrogen-based hormone therapy, what does that kind of look like for your process and in your exam rooms?
Yeah. So in the exam rooms, we have some resources for like visual aids if you decide that testosterone or estrogen therapy is right for you. And for example, if you want to do injections, we have resources to show you kind of step-by-step how we can do that. Our pharmacists are fantastic at injection training. So we sometimes utilize that space outside of our exam rooms to do some more one-on-one injection training before starting your hormones. In the exam room, the nurses can help with like going over choosing a site, rotating your sites for injections, things like that. That's super helpful. And then in the first visit, I usually go over kind of what to expect once you start hormones with regard to coming back or having your labs drawn every few months for the first year, which is a super important step to monitor your health while you're on hormone therapy. And just make sure that the patient also has that expectation in their mind ahead of time. Trying to get them familiar with the different people in the office that they'll be interacting with. So my nursing staff, the lab staff, the front desk staff, you'll probably come in contact with these folks at different parts of your gender journey. whether it be submitting documentation for a name change versus having your 3-month labs drawn, or requesting a refill for your hormones and running into trouble that you ran out of your injection supplies too soon. So there's so many people within the organization at different levels that can help you. And I really love that we're in a place where it feels safe asking for those things as a patient. Yeah.
That safety, especially within that power dynamic of, a patient coming in and sometimes not really knowing what they can ask for, or like shouldn't ask for, things like that. And it sounds like you're pretty open with folks. And I want to reiterate too that it sounds like you're able to start people on hormone therapy. Do they need any kind of like letter or anything like that? I might be dating myself here.
Yeah, no, not at all. It used to be that kind of a process, and certainly there's always fears that if that were to happen, that care would be taken away. But I'm absolutely able to prescribe hormone therapy. We go through this initial kind of meet and greet and get to know each other, make sure that we go through the risks and the benefits. But when you're ready, I'm ready to help you. And so that's the biggest gratification that I get in doing what I do, is I get to give that to somebody who is sometimes waiting years to get access to it.
Yeah, I like the that we're able to provide that like full care team, that we're not just saying like, here's your hormones, good luck.
Yeah.
There are people along the way to like help and like make sure that people are set up for success.
Definitely.
In this like part of their journey.
Yeah, I almost think of like all of our support staff as kind of a safety net for folks. Like, you are not alone at any point. We have triage nurses. Our call center staff are trained on how to answer calls appropriately and get them to the right people. It's nice to know that like every person in the organization is really trying to work for you to like get you the things you need. Yeah.
I know that's one thing that a lot of folks like are a little mindful or fearful of is, is this somewhere where I have to talk to this person on this date? I remember years ago, a clinic I was receiving care from had these like special afternoons every like third month where they like do gender affirming care. And I remember at the time feeling like so othered, like, oh, okay, like I'm not like normal care. Like you can't just get me in.
Yeah.
But it sounds like everybody's kind of in it together.
Definitely. Mixed in. I'll be seeing patients for their gender affirming hormones and checking their diabetes A1C and seeing another patient for their birth control needs. And I see all kinds of different things throughout my day. And I love that gender affirming care is just one of those things. Like it's just a part of primary care. It's kind of lovely to have it be that normalized in the setting that I'm working. So
yeah. Absolutely.
Yeah. Definitely need more of that.
I know that's my healthcare world vision that I'd love to see, is like more spaces where this is just a part of primary care.
So since we've been talking about hormone therapy, I guess what can people expect to start to notice when they first start hormone therapy?
Yeah. There's all kinds of changes to anticipate. I honestly feel like the one I hear reported most often that folks recognize earliest is like kind of that emotional shift or that mental shift of like a weight coming off of them. Things kind of feel like they're aligning, and there are growing pains. I mean, puberty in general is tough. But it is really interesting to feel like you're in tune with your emotions in a way that you've wanted to be for a really long time. That honestly is probably one of the first things that people will start to notice pretty early on. And that's the one that I get excited at, that first follow-up, because the first follow-up's hard. You haven't seen a lot of physical changes yet. And so just being able to talk about like those emotional shifts that happen and your mood that just starts to feel a little bit more in tune is really cool. Yeah.
I always think about like baking a cake. You can't just throw in the oven for 10 minutes. And, 1,000 degrees. Like,
you can't.
Sometimes it's a slow burn, right?
Yeah. If you want to get it cooked all the way through, you gotta go gradual with it. Yeah. I love that analogy. That's a great one.
Yeah, and I like you pointing out too that it's not just like gender affirming care is not just physical changes. There is the emotional changes, the mental changes that come with that.
Yeah.
Because I feel like a lot of people outside of the trans community don't really get that.
Yeah, I think that's probably a nuance of gender affirming care that's less discussed and less glamorized. I don't know if that's the right word. But I think probably most of my patients expect to at least have a little bit of an emotional change or a mood change, and I don't feel like a lot of the outside public understand that. Yeah.
The stat that always jumps out to me, and I might be misquoting this slightly, but in the latest version of the U.S. Trans Survey, there's 93,000 people who answered, and of the people who had taken hormone therapy at any point in their lives, I think like 98% of them said that their life was generally better after or during hormone therapy. And I mean, like, talk about like effective medications.
Yeah.
I wish every med was like that.
Exactly. Yeah. I think it's such a rewarding division, if you will, of healthcare to be in, because you get to see this is something that access to this type of care is going to improve someone's life. No matter how long they stay on hormones or how many procedures they decide to have for gender affirmation, that can all vary, but access in some way makes them feel more whole as a person. And that's always something that I will probably never get tired of seeing. So.
Yeah, that's amazing.
Yeah.
Thank you so much for talking with us today. Is there anything you want to leave people with, or any like words of wisdom?
Yeah. I think the thing that I really wanted to come on here and just kind of get across to potential patients who are maybe wavering on whether or not they feel safe enough to access care yet, is that we really want to be here. We really want to be giving you the care that you need, and it's what drives us. Me personally, it's why I keep coming to work. So if you feel ready, please don't let the fear of walking into a new environment be the thing that keeps you from care. I do think that Equitas in general is going to give you that safety net that I was talking about earlier. Like you're not going to be in an unsafe place when you come in for care. And I think that's just like the biggest thing I wanted to try and drive home is access can be safe. It doesn't always feel that way for folks, but we do our best to try and make it as safe as possible.
Yeah. I would say like also if people are still hesitant about making that first step, definitely come stop by during Mozaic's drop-in hours and just like relax and get used to being in the building. Because we are in the Equitas Health Medical Center building. So, and just, taking those baby steps if you need to do that. That's what we're there for.
Yeah.
I'm Quinn, and this has been another T-Chat. Thank you.